Next will be P&G Crest Oral B with Sarah Schaefer.
Good morning. Happy Friday. My name is Sarah Schaefer. I'm with Crest and Oral B. I've been doing this role for about 12 years now, and my most favorite part about working for Crest and Oral B is we are always coming up with something new, something to help patients have happy, healthy mouths, things that we're constantly innovating, constantly bettering their oral health. So let's get started. So what's hot with Crest and Oral B? Electric toothbrushes, for starters. How many of you have heard of the Oral-B Genius? Okay, all right. What's so great about Oral-B Genius is we're looking to help patients get a superior cleaning, change their brushing habits by helping them to be more gentle, not use so much force, be a lot more thorough, and help get all the quadrants instead of just the social teeth, which you all know what I'm talking about, the ones in the front. We're going to get them to be more thorough that way, and we're going to get them to brush longer so we can help them get to 2 minutes. So let's help patients brush their teeth the very best. We use a round brush head that's going to help cup the tooth and remove all the plaque from the surfaces. It's actually inspired by a prophy angle. As I mentioned before, we're going to get them to be more gentle on their gums, brush the full 2 minutes. So as you can see here, we use 3D action technology to brush the patient's teeth. Optimal movement gets you more plaque removal. You've got perfectly round each tooth with the cross-action toothbrush head that you see right here on this slide. It makes the job easier for the patient. That's what we're about. So when the patient's going to use the Oral-B Genius, they're going to remove 2 times more plaque and actually reduce gingivitis 2 times better than a manual toothbrush. So let's get patients to use less force. A lot of patients like to take their aggressions out on their gums, right? You see it every day. We know that 65% of people are visual learners. So we've got some cues built into this Genius toothbrush to let them know what too hard actually looks like. Okay, there's a visual signal around the top of the handle that flashes red if they're pressing too hard. The speed actually reduces and the pulsations completely quit so that the patient's not less likely to do damage to their dentin and enamel and gum tissue. So patients that actually use this function and use the Oral-B Genius, 93% of them actually reduce their over-aggressive brushing behavior in just 6 weeks. Surface area covered. Most patients don't get every single quadrant of their mouth, and a lot of patients seem to miss the same areas every single time. So with this app that pairs with the Oral-B Genius, allows the patient to see exactly where they're getting and where they're missing. Since we know that so many patients are visual learners, this is a very helpful visual cue in seeing where they're going in their mouth. 92% of patients actually improve their brushing thoroughness in just 1 month because of this feature. We even have a function on this app that's called Focus Care. So here, as you can see on the screen, Focus Care is built in the app that will work on the patient's smartphone that pairs with the handle where you can make specific recommendations in the patient's mouth of where you think they need to spend more time, okay? So you could make recommendations, say, hey, spend 30 seconds a little bit more in the upper right quadrant or lower left quadrant. That's just an example that you can see there on the screen. So length of time. The average patient, according to the ADA, spends 35 to 46 seconds per brushing session, okay? They're far under the 2-minute time recommendation. So what we do with Oral-B Genius is we're trying to help them brush longer, okay? We want to show them what 2 minutes actually looks like, so we're going to time them. We've got the built-in timer in the app. The patient will also be able to feel it vibrate in and out every 30 seconds, and it tells them when to flip quadrants. It'll visually show the time. It'll track personal achievement. It operates very similarly to like the Fitbit or the health bracelets that you see. The patient can actually monitor their activity and brushing habits by looking in the app and seeing what their average brushing time is over a week, over a month. Are they getting better? Are they getting worse? Are they doing their 2 minutes? Are they using too much pressure? The patient's actually able to monitor this behavior through the app. And patients that use the app while they're brushing their teeth, their brushing average actually went up to 2 minutes and 27 seconds. So that's a huge improvement right there. Let's talk about battery charge. One of the improvements we made on this particular model is it's going to hold a charge for a full 12 days. So no longer does the patient have to keep putting it on the charge base. Especially if they're traveling, this is a great feature. And that charge will hold as if you were brushing 2 minutes twice a day. They'll get 12 days out of that lithium-ion battery. So as you can see here in the app, this is a slide with the different screens that, we firmly believe at Oral-B, if you can't change the habit, change the tools. We want to help patients better their brushing habits. What better way to do it than through an app? Let's talk about Test Drive. Raise your hand if you've heard of this program before. Okay, so Test Drive has actually been for about a little over 2 years now. How many of you would ever buy a car without test driving it first? Most patients feel that way about buying an electric toothbrush, okay? It's a big step change. Most patients are used to using that manual toothbrush, think they're doing a great job with it, they're getting all the plaque off, but as you have seen in your everyday practice with your patients, they're not removing all their plaque, they're using too much force, they don't even realize they're doing this. You may have recommended an electric toothbrush on several occasions to some of these patients, and there's a variety of reasons they won't engage and take you up on your recommendation. That's where Test Drive comes into play, okay? Test Drive is gonna allow the patient to try the electric toothbrush in your office, in your chair, okay? So how does this work? This lets you coach the patient on the things we just talked about. Brushing time, pressing too hard, some interesting ways that we've had practices implement Test Drive in their practice is what you see right up here on the screen. You want to build it into your everyday routine. The offices that are the most successful with Test Drive seem to be the ones where the hygienist already has the Test Drive refill head and Test Drive protective handle sheath on their tray before the appointment. We have some offices that will begin using Test Drive right before surgery. We'll have some hygienists that will use Test Drive on patients when it's time for the prophy. They'll use a prophy angle on half the mouth and get Test Drive all ready to go and use Test Drive on the other half of the mouth. This lets the patient see how clean both sides of their mouth feel and why you're recommending that they get an electric toothbrush. We live in a trial society, so just verbally giving a recommendation usually is not enough. That's what makes this program so effective. So when you're using Test Drive in your office, you want to pre-identify electric toothbrush users. A lot of times, patients will tell you, I do use an electric toothbrush, but when they open their mouth, it tells you a completely different story. So using Test Drive is a wonderful patient teaching tool on how to be a better brusher and get better results out of the electric toothbrush that they already have at home. So it helps you help them. It's a great teaching tool and a great coaching tool. The disinfection procedure for this is super simple and very similar to what you're already doing in your practice with your disinfection protocol. 65% of patients who experience test drive in their dental office thought that their dentist or hygienist want the best for them. So it makes a profound impact on your recommendation of an electric toothbrush. And if you're looking to get more patients on electric toothbrushes, this is the best way to get it in their hands. So here, during the appointment, you can use the functions of the Genius to help explain how it works and how it gives them feedback. One of the best patient targets to do test drive on are those that you see with gingival recession. You can explain how the Genius will flash red on the handle when they're pressing too hard, okay? You can teach them about 2 minutes. You can show them how the Genius helps them with that. But overall, you can help change their behavior by letting them try it out in the chair. So if you've ever felt like having electric toothbrushes or anything for sale, for that matter, in your practice makes you feel like a salesperson, this tool is designed to help make you feel less of like a salesperson and more of like a recommender. Okay, as you can see up here on the screen are some sound bites that some of our offices, the hygienist and or doctor have used that have been really successful in getting patients to try test drive. It's a great way to try it before you buy it. Another way to look at this is you can't get the same experience at the store, right? You can't walk into Target or Walmart and pull one of these off the shelves and stick it in your mouth and try it, right? No, it probably wouldn't be a good idea at least. So this allows you to get the patient to try it in the chair. So Crest Pro Health toothpaste, we've got clean mint. You can see here, we've changed up the formulation a little bit. The stabilized stainless fluoride we still have, but we've actually changed the stain mitigator. So if you've had patients that tried Pro Health in the past, and had sloughing, we've changed the formulation and changed the stain mitigator so you get all the same benefits without the sloughing. You can see how it compares to Colgate Total. 44% better in proximal plaque reduction, 27% better acid erosion versus Sensodyne Pronamel as well. We are giving samples of this out actually at our booth, so I welcome everybody to try it. I know I'm running out of time, so I'm kind of flying through these slides, but come to our booth. We're actually doing a drawing, and the winner gets a new Oral-B Electric Genius toothbrush. We've got brushing stations for you to try the new Genius yourself in your own mouth and take it for a test drive. Thanks for recommending Crest and Oral-B products to your patients. Have a great show.